Hello and welcome to another episode of Tuesday Health Talks, coming from the Schneider Clinic with Dr. Mark and Dr. Matt, M&M as we're calling this. So yes, hello to everybody, and today we are going to talk about degenerative disc disease, or DDD. This is in the spine, and just a little maybe anatomy about the spine. There are 24 vertebrae that make up your spinal column. You might feel those bumps in your back when you kind of turn around and feel your spine. If you were to count them, there should be 24 of them in the spine. And in between those is a cushion that is called a disc. And that disc is made up of some fibrous material that goes around a soft, spongy material or rubbery material called the nucleus of the disc. Many times when there is injury to that area of the spine, whether it's from a fall, repetitive motion, maybe a twist that has happened, an accident of some sort, over time you can get the disease called degenerative disc disease, or DDD. And Dr. Matt's going to go over a little bit of what you see behind us here with the spine to kind of just give you some visual of what that looks like.
Alright, so here you got your spine coming around, and on the side here coming up is what we call is the nerve canal. So that little hole where that yellow nerve is coming out of, when that disc goes away, it comes down and pinches right on that nerve, decreasing the space, causing severe pain, numbness, tingling depending on where it is, down your arms, down your legs. You can see that disc above is a good disc space compared to the one below it. It's down, there's no space left, it's choking on the nerve that's coming out through that little canal.
So you've almost got, in this area, almost bone on bone.
Mm-hmm.
And that bone on bone really, as he said, narrows that space where the nerve comes out. Because remember, 24 of those, which means you got 24 pairs of spinal nerves that are coming out all the way up and down your back. So with that, this can lead, as Dr. Matt said, to numbness, to pain, to tingling, to weakness, in whether it's in your arms, whether it's in your legs. Sometimes that'll even affect your organ system. Sometimes you'll hear a diagnosis of degenerative disc disease. The doctors might say you have spinal stenosis, or you have a pinched nerve, you have a collapsing disc. Those are some of the things that you might hear. If that gets bad enough to where it really pinches on your cord, as you can see, or those two bony end plates begin to kind of crush together and almost create a natural fusion, you will see a lot of arthritic spurs develop along there. That's the body's natural way of trying to actually secure that and guard against any further damage around those nerves and cord. So one of the best things, for myself, having treated patients for now over 30 years, one of the best treatments that has come out in a long time, in the early 2000s, and we really started using this particular treatment in 2006. It's called decompression spinal therapy, and that really works to kind of reverse that process in the cases of degenerative disc disease, where that space has really been compromised and has come down. We want to open that space back up to try to free up that nerve and also draw some of those fluids and rehydrate those, because your discs are really 80% water. That's what keeps them nice and flexible and kind of rubbery, as we would say, allows you to bend and flex. And when you lose that space, you lose the ability to do that. So you may feel that stiffness along with a lot of the pain and the numbness and the compromise of maybe even the organ systems that function that way.
It's a process called imbibition, where the water will flow back into the disc as you elevate and increase the space between the two vertebrae, allowing that disc to then reabsorb the water, just like a sponge would. If you put it in water, it reabsorbs that water, it swells up, so that your disc would essentially do similar kind of a thing.
The treatment of decompression really, in my opinion, has revolutionized being able to open up that space that's in the spine, free up those nerves, and reverse a lot of the symptoms that you would be noticing in there. It's also a very non-invasive procedure, so there's no knives, no needles. Some of the procedures that are out there, what I would call on the medical side, would be a rhizotomy, which is kind of a nerve burn. They will take a needle in and they'll go inside and try to burn the nerve, cauterize it, as they say, to kill the pain. But you also, if that actually works, you'll kill the function. A lot of times also they'll try to go in and cauterize some of the disc or cut some of that disc material off. If it's a really bad situation, they'll actually go in and put a cage, as it's called, or they'll take screws and rods and plates, and you can see that in this quick x-ray here that shows these rods and these screws that are going in. And that really fuses the area of the spine where the problem is, but what it a lot of times does is, because it doesn't allow any of that to move, you end up with the disc above or below taking a lot of the stress to that movement now, and that one begins to get damaged.
To go back to those x-rays of the surgery that we saw before, that is restricting all of that motion in those joints, not getting that flow of the arteries supplying the discs and not allowing them to regain space and heal and absorb properly.
The decompression we have found, of course, as we're talking about DDD, or degenerative disc disease, which can lead to the spinal stenosis, to the collapsing of the disc, that pinched nerve scenario, maybe the numbness and the pain, maybe you're sitting down and you go to get up and you just can't get up, or maybe you're walking through the grocery store and you say, oh my goodness, I need to sit down, or I need to lean on the cart. That's just telling us that that disc space in there is really decreased, and it's putting that pressure on those nerves. So we want to reverse that process. And decompression, because we can isolate just that disc area that is causing those issues, that's what really allows us to put enough distractive forces into one level. Today we've been talking again, like I said, about DDD, degenerative disc disease, or decay within the disc of the spine. Hopefully you found this information interesting. If you've got any questions, certainly you can call Dr. Matt or myself at our clinic, which is on the bottom of the screen, schneiderclinic.com. You can see more about the process, or dial 574-293-7000 and set up a time. Be more than willing to do a free consultation and see if this type of procedure, this type of treatment would work for you and get your life back. So thanks for joining us today, and we'll sign off till the next episode of Tuesday Health Talks.
Tuesday Health Talks.
Is that what it's called?